I am Vino Pajanor, CEO of Catholic Charities, Diocese of San Diego.
We're seeing migrants being dropped off at San Ysidro trolley station, transit station. Is that because the NGO shelters are full?
Before I can get to the point of what's happening now, I have to take back in time and look at what has happened in the last 28, 29 months of where Catholic Charities has been in this migrant respite shelters. So Catholic Charities partnered with the state of California starting on April 4th, 2021. And Catholic Charities was the operator of 3 sites, 3 shelters, 1 in San Diego, 2 in Imperial County, a total of 1,600 beds. For this 28-29 months, the operations here has been led by the state of California with California Department of Social Services, Cal OES, you had CDPH, there's public health, and everybody involved in it. So it has been a state-led model for the past 28 months. Now, with this fiscal year, we all know that the state of California is facing a budget deficit. They have invested $1.2 to $1.4 billion in the last 4 years to do the shelter and care for the asylum seekers who are getting dropped off by DHS, which is Border Patrol and ICE, in this last 4 years. So with this deficit, the state of California said they mobilized during COVID, they mobilized, especially after the surge in February, March of 2021, state of California mobilized their agencies, that is Cal OES, CDPH and others, right? And the emergency is over. A lot of those protocols that were placed during COVID is gone. And then the state of California is facing a budget deficit. The state has now decided that they can't be bearing all of the burden of sheltering and caring for the migrants who are getting dropped off. So starting on September 13th in Imperial County, and then on October 1st here in San Diego, the state is going to have the NGOs, here in the sense of Catholic Charities, being the lead instead of the state being the lead as it was previously. What does this mean? This means that the state is going to not have a presence like usually they have it on site with Cal OES and other agencies actively managing the operations of the site. So starting on September 13th, we used to have 2 shelters in Imperial County. We are going to go to 1. We have already gone to 1. The one shelter that was there, the Barbara Worth, is not going to be there anymore. So the only other shelter is going to be there, the Travel Lodge, and we're going to have that alone.
What's going to happen here in San Diego?
So Crown Plaza, where currently the migrants are being sheltered and cared for, is going to close operations as of September 30th, and we are going to go to a new location on October 1st.
Are you able to say where that location is?
Not yet.
Okay.
Not yet.
But it will house less, let's just talk only about San Diego, it'll house less migrants, right?
It'll house, like, if you're going from 1,600 bed capacity, so you have to take Catholic Charities as operating in 2 counties, because the total number of beds enables us to load balance whenever there is a surge in one particular county or the other. So we're able to move people. So
I understand that migrants go from here to all 3 shelters.
Yes.
Okay, so it's my impression that DHS doesn't drop migrants off at transit stations unless there's no place to put them in the NGO shelters. Is that true?
Yes, when they reach capacity. So what is happening now is the state, as of September 13th, yesterday I'm talking about, said that they're going to start the transition process of moving all operational leads, everything to Catholic Charities in the 2 shelters that we're going to manage. So during this transition for the next 2.5 weeks, this is until October 2nd, that this transition is going to happen. So 28 months of state leading the operations, now Catholic Charities is going to take over. So during this time, the state has recommended that the shelters go into a vulnerability screening environment where we take in the elderly, the sick, the women with children, and families with children, young children, the few other categories under which the vulnerable populations are screened, and we share that with DHS, ICE and Border Patrol knows. So when they're screening these individuals, they screen out those single healthy adults, and they would not be dropped off at our shelters. It will be only those vulnerable populations that are there. and the rest are going to be released onto the streets for the time being until the transition from the state to an NGO-led model is complete. And we will reassess. And we'll reassess on October 2nd. On October 2nd, we are going to reassess and say, hey, has the transition been good? We are going from a 1,600 capacity to a 800 capacity bed. So if we have the still capacity and we don't have all the beds occupied by the vulnerable populations, then we will take on also the single adults. Because if we don't do this right now, we might come into a position where some of the healthy adults, single adults, are occupying beds that need to be occupied by the vulnerable populations. And then DHS will start releasing those vulnerable populations on the streets, which will be even worse than having healthy single adults being released onto the streets.
So are you telling me as of October 1st, you are reducing your capacity by 50%?
By 50%, yes. It's going to go because of the funding that is being reduced from the state, because of the state has invested 1.2 to 1.4 billion in the 4 years, but the deficit that is coming up, they are not able to sustain it until there are federal funds that are going to get pumped in and others are going to happen for taking those care of those individuals that are released. It's going to be a very difficult proposition to house them all.
So this reduced capacity is causing the migrants, the single adults, the non-vulnerable population to be dropped off at transit centers right now, right?
Yes.
Okay, all right. Cal OES, you're saying, is being eliminated as being on site. What did they do on site?
They are the ones who did all the logistics operation. For example, they coordinated with DHS, they coordinate with Border Patrol and ICE. They do a lot of operational logistics that are very essential for a safe environment, a safe and healthy environment. So they were almost like the backbone service provider for the shelter operations.
Okay, well, just because they're handing off administration to NGOs doesn't mean that the state isn't still paying you to do this, right?
Yeah.
You're still going to have contracts with the state to run these shelters, right?
Absolutely.
Taxpayers are paying for it, right?
Taxpayers are paying for it, but at a much reduced cost. For example, if you have Cal OES operating there, there's a cost involved for them to be there. If you have CDPH, which is the public health there, there's a cost involved with that. So with all of these agencies drawing down or getting demobilized, as they say it, that means those costs are going away. So the only cost that will be there is, of course, for Catholic Charities to run the shelter, do case management, provide food, provide health care, which is basically screening with our medical provider, and do the necessary to keep the environment safe and healthy, and so that people can come in and move. So, in this last 28, 29 months, Catholic Charities has sheltered and cared for little over 252,000 individuals. Out of them, they stay there for an average of only 1.5 days. They come in and they move out. They go to all across the country. And what we do is we just don't fly them out to these various cities. They get a warm handoff with their sponsors, with their families, and so they reunite with them. So that's what is heavy case management. And 98, 99% of all individuals who have come to our care in this last 28, 29 months, all of them leave San Diego. It's very rare about one person stay in San Diego, and we try to figure out where are the locations, how can we get them housed either in San Diego or within any other locations that we can find them.
Can you give me the laundry list of what kind of services are paid for by the state? We know the hotel rooms, we know meals, medical screening, probably security for your shelter operations, your overhead, your staff. Anything else I'm missing?
That's almost all. That's what is basically, those are the things that are needed over there. Because in order to run the shelter, you need case managers. You need security so that people know that they're safe and secure there. You need janitorial services. You need food over there, food services. So you basically covered it all. So those are things that are underwritten. And also, it's just not only the state that is providing funding. There is also some very limited federal funding that is coming in. So you must have heard about the SSP funding, which is coming through FEMA. And CBP through FEMA, and it's known as the SSP funding, and that's very limited. So whatever is not being paid by FEMA through the SSP funding is now covered by the state.
Can you tell me why it's important for taxpayers, in your opinion, to be paying for these services? The reason why you do this?
So why Catholic Charities started doing this was one simple reason. These individuals are legally processed and documented by DHS, which is Border Patrol and ICE. They show up, they give a document to them for a notice to appear in a court, which is the immigration court. They say you have to appear on that date for your hearing, for your asylum petition. You have to go through the process. So they're here in the country legally. They come and get dropped off by DHS or ICE at our location. We are a country of laws. We are a country of due process and equity. So they are here. They need to start doing that process. If we don't take care of them, they're going to end up on the streets. There's going to be street releases. We already have a homeless issue. The unhoused in our streets are at a crisis level. Now, if you have hundreds and hundreds of individuals getting released onto the streets, what happens? They're going to be lost. When they come to our location, whether it is as Catholic Charities or other locations, they are provided case management. They do not know the language, they do not know the system, they do not know anything. So when they come in, they stay there for 1.5 days. So we are able to move them out of San Diego to their final destination, reuniting with their families and their contacts in the United States within a day and a half. If that navigation is not provided, if that case management is not provided, the 1.5 days could be 1.5 weeks, 1.5 months or more. They could be lost. They could become victims on the streets. They are now maybe coming in with other ailments, sickness. If they're not screened for those sicknesses and they're released into the streets, what happens to our streets? What happens if there is other kind of illness that is being spread? So what Catholic Charities has been doing for 28, 29 months is not only to provide this service to the asylum seekers, it's also to ensure that our community at large is also healthy and safe and secure.
Aren't your concerns you just expressed to me that these people are going to be lost? Isn't that what's happening now? We're having hundreds and hundreds of individuals released onto the streets now without going through your services. Doesn't that concern you?
It does concern. The street releases does concern, but for 28, 29 months, the state has been providing that funds to operate a larger shelter. The state is facing a deficit. It's now time for the federal government to step in and say, here are more resources. You Californians, you San Diegans are a welcoming environment. You have welcomed the stranger, provided them care and shelter. Here we are going to step up and provide these resources, funding resources to you locally to continue doing what you have done. So the question now becomes is the federal government, the federal agency is going to step up and provide California and San Diego its fair share of funding so that we don't have people on the streets, so that we are able to provide them case management and navigation so they reunite with their families and follow the due process of law that they have been told to follow when they were admitted to this country.
Who's doing medical screenings on those individuals being released at the transit centers now? Are they getting medical screenings?
That is a question for DHS, and there might be a question for other agencies involved in that effort. We are not there. We provide some humanitarian care, whether it is we are able to ship some water or blankets to various agencies that are providing it, but it's for more of those other agencies locally and for maybe the federal government to come in and say what kind of care, medical care is being provided when they're released onto the streets.
Somebody's got to be screening them for COVID or other illnesses before they get released at the transit center though, right?
I hope so.
You must know whether they get screened or not.
Because whatever is happening at the DHS side, we don't have purview, we don't have sight.
I know you don't control it, but you must know whether they're getting screened or not.
That is a question for you to ask DHS of what they're doing, because sometimes for us, all we know is when they get off that bus and when they come in, we tell them as soon as they get off the bus, our team members tell them, you are no more in detention. This shelter is not a detention location. Of course, there are certain protocols. You cannot smoke on site, you cannot drink on site, you cannot be going in and out of the shelter. So those are protocols that they have. So if they abide by that, they can stay. But anything that is happening at the DHS side,
well, they won't tell us what's happening at their screening sites, you know?
that's our DHS. And so we we are as good as you guessing us what's going on internally. So it's a question that you should be asking DHS.
Okay, very good. Anything else you wanted to mention?
Also, if people are wanting to volunteer, because we San Diegans have been a welcoming environment, whether it is in the fire or floods or earthquake, at any time, we have been very generous. And even during this 29 months that we have been doing these migrant shelters, San Diegans have been generous. If your heart is called to provide your time and talents, go to our website, ccdsd.org, and look for volunteer opportunities for you to provide your time and talents. If you have lightly used clothing, lightly used shoes, shoelaces, or others that you would like to donate, go online to ccdsd.org and donate. Just for all the public here to know, for San Diegans especially, Catholic Charities is providing the services because we are not only trying to take care of the migrants, but also taking care of our local community. Because if we don't do this, these individuals will end up on our streets. And there'll be more unhoused individuals on our streets than what we have today. So it's for you and us to figure out how we are going to do this in a very responsible and a very humanitarian way so that we don't have a crisis that will blow up on our streets here in San Diego.